Hello and welcome to Access Chat. I'm delighted to welcome Anthony Ruck. It's been rather too long in coming. I've known Anthony for longer than I would care to mention. I think we both had a lot more hair when we first met. And we both spent a long time in the assistive technology world and fields. Most recently, Antony has been working on European projects around assistive tech, and prior to that was in charge of the British Assistive Technology Association. So welcome, Anthony. It's great to have you here, and I'm really keen to hear about your latest work and what you're doing right now.
Thanks, Neil. I'm delighted to be here, first of all. Thank you to yourself and to Deborah and Antonio for having me along. Yeah, I think somewhere back in the 90s we first met. So yeah, an awful long time ago, but all good. It's been a rollercoaster few years. The opportunity to work with BATA, the British Assistive Technology Association, came around about 8 years ago when I first went self-employed as a consultant. And I was very honoured to be asked to become the chair of the organisation, which was kind of intimidating following sort of hot on the heels of Martin at Inclusive Technologies and Mark McCusker out of Textile, two sort of very important figures in the industry who've done an awful lot for the sector. And I didn't bring the kind of resources and success stories that they brought to the post, but they'd done so much to take BATA to where it was. The mission from there was really to sort of work out how we took it forwards, and it was a maturing organisation that needed to find its place in the world and become independent of itself. So it was, in a kind of way, a bit fortuitous to land in the right place at the right time. Nothing more, nothing less. So yeah, one of the things we became aware of is that when we're having any of these conversations, it's very easy to become railroaded. And to become a bit of a one-track conversation, because you keep sort of referring back to what's urgent and not looking at the wider picture of what's important. So as an organisation, we stole the idea from somebody, I can't remember who, but we stole the idea to sort of split up our workload into what we call special interest groups. And that's opened up huge amounts of avenues for us and enabled us to really engage with the membership, as well as sort of setting some goals and some missions for the organisation that we could take forward as task and finished projects, which was great. And as I say, that was around about the same sort of time I was sort of initially self-employed. And I was very, very lucky at that time to sort of spend some time going to events like ATIA in Orlando, sort of seeing what's going on in the big wide world of assistive technology. For anyone who hasn't been to ATIA, you really must go. It's a wonderful event to go to. A real eye-opener and a real sort of opportunity to see what else is going on in the world. As part of one of the meetings there, representing BATA, we had a meeting of a lot of representative organisations from around the world. And I was very fortunate to meet a chap called Christoph Müller, who represents the BETT in Germany. And they're kind of the German version of BATA, representing the assistive technology industry. And we got talking, and the general upshot of it was that, you know, the US has great events like ATIA and CSUN, M-Enabling, and Europe was very fragmented. There was nothing that was sort of pulling all these organizations together and sort of sharing those resources and sharing that voice. As somebody said to me recently, sort of, you know, it's much more powerful being part of a choir than a lone voice. And that was kind of how we felt in that industry. So working with Christoph over the last couple of years, we've ended up sort of pulling together, in conjunction with several other people who contributed huge amounts, an organization called DATEurope, which is the Digital Assistive Technology Industry Association for Europe. And really the aim there is to unite the assistive technology industry around Europe, because we're constantly doing the same things. We're constantly answering the same questions. So why don't we get together and answer them once, instead of sort of answering them 8 times in 8 different countries and, you know, then doing it again a couple of years later. And also the great practice that's out there. You know, there's a lot of governments that are doing fantastic things to promote assistive technology, to promote accessibility, to promote education, to promote awareness. But it's all siloed. So, for example, in the UK, we've got the Disabled Students Allowance, which is a phenomenal scheme for supporting students at university, non-repayable grants, which helps with their technology, their training, and does a huge amount for them as individuals, for the colleges, for their prospects, and for the UK economy. So why aren't we taking great ideas like that and sharing them around Europe, and going to the German government and saying, well, look, this is what that does for that tranche of people and those individuals and that economy. Why aren't we replicating these things? And likewise, there are other great schemes around Europe that if we can pull those together and share those back, then we can hopefully take the whole continent forwards, if not sort of working with other organizations to take the world forwards. Be a wonderful thing.
Excellent. That's really good to know that we're not reinventing the wheel again, or at least the intent's there, because I've frequently seen it, and yes, I mean, it's really good to bring the industry together, and I think there does need to be some sort of consolidation and rational approach to some of this stuff. So that's great to see, and it's good to see it also coming from parts of the world that support languages other than English, because that's also really massively important. So, Deborah, I see you've got a question.
Well, I first of all, I applaud what you are doing, and I agree with Neil. Breaking down the silos, coming together so that we can support each other. I've been to ATIA many times, and I've been to CSUN. I actually like ATIA a lot. And I haven't been there in years, though. I haven't been there in a few years. But I found that it seemed like the audience had shifted, and it was more of our from the lens of the US, our special educators were coming to it, and a lot of academia was coming. And thank goodness, because I know that when my daughter was in school and needed assistive technology, nobody knew what I was talking about. The teachers were not trained. I think there was one AT provider for our entire county and every single school in our county, which is a lot of schools. But one thing that I'm concerned about with assistive technology is it just feels like we are not talking about assistive technology. There are some assumptions, I think, sometimes out there that we don't need assistive technology, that assistive technology is old and tired, and it just keeps our community held back. All you need is an accessible website. You don't need assistive technology. And I keep saying to people that say that, well, actually, the person has to actually navigate through their computer to get to that website using their assistive technology. And then there's references or inferences that mainstream technology can solve all the problems that assistive technology was solving. And by the way, there's some truth to that. There's pieces of the assistive technology that we now are embedded into operating systems, but it just feels like the assistive technology industry is not being included in a lot of these conversations. You mentioned accessibility. We talk about disability inclusion, but there seems to not be a lot of support of the industry or understanding why we need to support it, much less than getting into the complications you were talking about, and that the silos and we're better at being a choir than one voice. I know I'm throwing a lot at you, but I'm actually very concerned about these things. I just, because I believe we still do need assistive technology, and yet it's being attacked. It's being attacked and saying we don't need it. So.
Yeah, wholeheartedly agree. I think the absolute essence of everything that the sort of the AT industry does is around the individual, and the way that the individual accesses their computer, the world, their going shopping, getting out, it's got to be based around the individual. There is no one size fits all. There is no sort of panacea of products that says, we have the answer to all of your needs. It doesn't happen. And sometimes that requires a combination of products. Sometimes it requires one product to be customized to that individual. there are so many ways of sort of, supporting the individual in that process. And one of the things, I suppose, from the industry's point of view, is that we probably haven't sort of, 10, 15, 20 years ago, we weren't great at coming together to solve problems. We were all doing it individually and then sort of saying, I've got the best one. That has been a sort of shift in mentality in recent years. And there is much more of an ecosystem that is joined up and looking to share the technologies and the IP and the way that these things are adapted, and also to promote the different options. Things that BATA and DATEurope look to do is to make sure that everybody is aware of all the things that are out there. And then, again, that is, working in a world where resources are scarce. Nobody can sort of have unlimited resources to complete reinventing the wheel every time, or carrying it the same piece of research that everyone else has done every time. If we can share that information and share that learning, share the failures. If it didn't work, let's not be shy about that. It didn't work, let's learn from it. But yeah, one of the significant changes, really, I think, in assistive technology was when the big IT companies went from supporting the ecosystem to sort of taking over the ecosystem, and the messaging changed from "we're supporting you" to "we can do all of it ourselves. You don't need those bits. We've got all of it." That is a dangerous message.
So I was wanting to come in and comment on that, and I think that there's definitely been a shift. And there has been that sort of message that we've got all the answers, and I don't think anyone has all of the answers. At the same time, I still applaud the widening of access the free tools have enabled, right? So I think that one of the charges laid at the feet of the assistive tech industry has been that the software is really expensive.
Yep.
And you and I, having worked in the industry, we know that some of that is down to the fact that it costs money to develop, and if you're not selling it to many people, that cost is spread over cut into bigger chunks of you have to pay for a bigger slice of the cake. But they're also the way that other technology industries licensed their components to the assistive tech industry inflated the prices too. So, for example, if you're licensing a text-to-speech voice for a game, you pay one price. If you're licensing it for a piece of assistive tech, you pay something far more.
Yeah.
And so the whole sort of supply chain and ecosystem also pushes up the price of assistive tech. So there are a number of factors at play there, and I'm not saying that some of the assistive technology companies haven't got away with fairly high prices for quite a long period of time, because I think some of them did. But at the same time, there is a cost to making this stuff, and there is a cost to maintaining this stuff, and certainly for some specific disabilities, it's never going to be mainstream, and therefore there has to be a price paid in development done on this stuff. So therefore there is a need, and it will be expensive, but at the same time, society should be subsidizing that. There needs to be ways of making this stuff available. So I think that there's still issues to resolve around how we give people access to the tools, how we fund the R&D, etc. But there's room for everyone to play, and I'm sure Antonio has a point, right? So I know Antonio wants to make a point as well, but I'm going to come back to this because I think there's other stuff at play as well around interoperability and so on, and that's a huge issue, and that's an area that we spend a lot of time on.
Now with everyone working from home, particularly the case of schools, teachers, students working from home. We've seen that in some parts of the world, teachers were on their own, searching for technology, trying to help the teachers in the best way they could. And I was able to see that some vendors were able to jump and try to support the teacher and tell them, oh, we can, we have this solution here. You can use our freemium software and all your needs for your students are solved. My question, Anthony, how can we improve the PR of assistive tech? How can people working in assistive tech better respond to the need of the users? Because some of the commercial vendors are doing that, and somehow, in some cases, competing with assistive tech. How can assistive tech be more willing to listen and react on the needs of the users?
Fabulous questions, I have to say. I'm sort of completely by coincidence. This morning, I was at a meeting of the Department for Education here in the UK, and they've just reintroduced their AT Experts panel with some phenomenal names from the UK sector in there. And looking at exactly that, what is the method by which teachers understand what AT is available? I think it was particularly highlighted sort of over the lockdown and over the pandemic, and obviously that's still with us for the time being. But yeah, where is the trusted source you can go to that's impartial, that will give you the advice you need, that will have other teachers commenting whether this was a great resource or a bad resource, that also feedbacks into the loop of the industry and says, okay, your license for your software was for us to use for 5 kids in school, but they've all now gone home. We can't, access them there, but my teacher still needs the license because they're providing the information. And I've got to say, I think genuinely the AT publishers that I work with did a fantastic job of amending their licensing immediately and just saying, look, guys, if you want to take home licenses, take it. If you want additional licenses, they're yours for your teachers. They're there for the parents. And they put on a lot of online resources at the time to train parents to do their best to become teachers. And I've got 2 young boys. I'm no teacher, I've got to say that. No, I'm definitely not one of life's teachers. I was ultimately a challenge. But it was amazing, sort of the resources that came out of the industry at the time, for which I absolutely take my hat off. It was a great lesson for us as a sector in where we can come together and share that. Look, guys, there's a need. How do we react and react quickly? And for that, I absolutely applaud all the players in the industry for coming together quickly. To pick up Neil's point around pricing as well, it is expensive to develop assistive technology. I'm currently working through the development of a piece of software with a client, and it's already stretching into the hundreds of thousands of pounds. So when you start to sort of look at your business model to recoup that, that becomes a challenge. Again, thankfully, sort of we have something called the Innovate UK grant system, which is a great government-funded grant that contributes to the research and development of new technologies, and obviously very keen to do that in the wake of the COVID pandemic. But yeah, it's a challenge, and how we negotiate with the big IT players to say, look, license your technologies to us at a more affordable rate, and this is the benefit to you. And whether that's reciprocal agreements or publicity, how that works, there are ways of doing it. And I think it takes me kind of back to the start of this. We can do it as a group. Incredibly difficult to do it as an individual.
Agree. And I saw that, I know that we saw a lot of problems with, once again, constantly price is an issue. It's an issue. And I know that we're all fans of David Baines, and we've had David Baines on here before. I loved when David Baines was working with MATA in Qatar, and they paid the AT provider, some of the AT providers, to create their products in Arabic. And then in return, they would get licensings of those products. So that's another huge issue that we have, is making sure AT is available in the native languages. But then making sure that the individuals that use the assistive technology have access to it, whether they're working from home or they're at school or they're at the office or wherever, it continues to be a confusion and a problem. And I think also, I think AT needs to be rebranded. because I think people are very confused about what we're even talking about often here. And because I hear people saying nobody uses AT anymore. And I know that's not true. I would ask Neil if that's true, since he uses it all day long to do his job. So there seems to be confusion. I remember in the past, we used to call it adaptive technology.
Yep.
And I don't know if we still call it adaptive technology in some places, but it just feels like somehow assistive technology has become the redheaded stepchild. As I don't know where that saying came from, but hopefully it's not racist against anybody. But it just seems that I don't see the AT providers and experts being included in the other conversations. I remember being so frustrated when we would be talking about disability inclusion from the employment lens, and nobody was talking about accessibility. Mm-hmm. And I remember just going crazy in the States saying, wait a minute. If we don't bring accessibility into this, we're going to continue to be excluding people with disabilities. But somehow, as we've walked these paths, we have the big technology people in, woohoo, we have accessibility, we have the corporations in, thanks to people like your wife, Lucy Ruck with BDF, and our lovely Dr. Caroline Casey of the Valuable 500. But I don't see the AT experts being invited to these conversations. I often will invite David Baines just because he's amazingly brilliant. Now that I know about you, Antony, yay, good to know about that. But why do you or Neil know why? What happened? Why are we not? What happened? When did AT become invisible and not needed? Am I the only one that I'm very concerned about this? And we're not supporting the entrepreneurs. So was there something that happened to cause this, or just a series of things?
I think there's a few things at play here, Deborah. There are other people, so I think some of it got subsumed into accessibility.
Okay, right. Agree.
So a lot of us, my job title isn't, I'm an assistive technologist, right? That's where I started my career along this path, was playing with assistive tech and speech recognition and building computers that worked with it because it was pretty flaky. And I worked with another assistive technologist that you will recognize the name of, Abby James.
Ooh, she's
but guess what? She's an accessibility expert now. But the thing is, accessibility requires working with assistive tech, and this is the interoperability piece, right? So whilst there are assistive features in mainstream products, they don't have the same capabilities as the specialist assistive tech yet, because they're kind of fragmented and siloed. And so that has an impact on end users. And so you say I use assistive tech all day, and I use a mixture of my specialist assistive tech, so the Dragon speech recognition, and I use the Microsoft stuff. The reason I switch between the two is quite simply that Dragon is really processor and RAM hungry and can slow my computer down. And if I just want to dictate a few lines, then I'll press the button that's already in Office. But at the same time, I don't have the same kind of quality of control. So I have to do manual corrections, and it hasn't learned my vocabulary in the same way that Dragon has. But if I just want to do something quickly, I'll use the inbuilt stuff.
Yeah.
Okay.
But equally, I can't use that inbuilt stuff outside of that particular ecosystem. So if I want to go and use dictation in some of my company software, what we call our line of business apps, it doesn't work. So then I have to go to Dragon, and then even Dragon can be a bit flaky, and that's where the accessibility piece comes in, because you've got to work on the interoperability between the assistive technologies and the mainstream tech. So there's more at play. So there's more than just a name to it. I think that that the assistive features are great, that we need them. It's the, and I'll argue with the Hector Mintos of this world, whether it's 80-20, 90-10, that they're the sort of mass market sort of tasters. But if you really need it, you need something which is much more sort of heavy duty, feature rich, robust, to be able to do what you need to do.
Yeah. No, you're right. You're right. I think, you know, when it comes to things like marketing budgets, no matter what the messaging is, some marketing is ubiquitous. It's everywhere. You know, you use any social media, use any website, you'll get the adverts popping up talking about mainstream media and mainstream technologies, and you won't get that in the same way, you know, for a lot of the assistive technology products. So I think that the awareness of assistive technology dropped. I don't think there was a period where assistive technology wasn't sexy. You know, you had iPads suddenly appeared on the scene, and everyone, wow, you know, I can zoom, I can pinch, I can do this, you know, and that was cool, and people wanted to be seen with an iPad, and that kind of took things away. But then I think we're coming back the other way, because I think that customization piece and the ability for somebody who's an AT trainer, a practitioner, to go, I've got a good idea, and I'm going to develop an app that does this, because there's a niche there of people that aren't being catered for. It's enabled that to happen now, and I think sort of it is coming back, and I think people are sort of professionalizing those products more. You know, a lot of the user interfaces weren't that pretty. They looked a little bit like something I might design, whereas, you know, now sort of, you know, we're at a stage where, you know, people are coming together and they're able to do much better design graphics, and then the sort of things that they're acceptable in the workplace, they're acceptable in university, they're things that you want to use at home. You know, there was also, I think, a degree of what you were promised and what you got that didn't quite match. So I looked 20 years ago when I first saw Dragon being demonstrated, and it looked amazing. And I tried to use it, and it was not very good. That was the polite version. Now, Dragon has met that expectation, and you use it now, and it's a phenomenal product. You're right, Neil, every so often you'll get your flaky moments with it, and it will type up some gibberish. But for the 99.9% of the time, it's a phenomenal tool. And I think as that develops and that increases, and I think we start to mainstream those assistive technologies, so they're not seen as being the thing that stands out. They're becoming productivity tools as well. I think, you know, we're all, you know, using mind mapping, we're using speech to text, we're all using those sort of solutions that help us with our work, and improved spell checkers that don't just do squiggly underlines. They actually, you know, work you through a process to find the right word, build your vocabulary. There's a lot of very clever stuff that's coming through, and I think we just need to raise the awareness of it still being there.
Excellent. Yeah. So, Antonio, you had a piece that you wanted to ask the with this.
Today, there are no, we could call it incentives that we didn't have in the past. So we have a regulation, for example, in Europe, that where governments need to follow accessibility guidelines, and apps and systems within some government for employees need to be accessible. So is the accessibility technology industry taking the opportunity to leverage these changes?
Trying to, yes. You know, I said the challenge has been, you know, DATEurope has only sort of been really in existence for a few months now, and the difficulty has been sort of coming together as a big enough body and a sort of, you know, an impartial body as well. You know, it's very, very easy for any organization to be overcome by, you know, one or two players who are very vocal and got a big budget, and take it off in that direction rather than sort of going for a consensus voice, which is something that, you know, hopefully with BATA and with DATEurope we've managed to do. And that's then, you know, as I mentioned, the meeting with the Department for Education this morning, it's because we're becoming a trusted advisor, a trusted friend, that we're being invited into those conversations, so that accessibility and assistive technology are being considered at inception, conception, whatever it may be. But that is so much easier and so much more effective than waiting until the project's been delivered and then going, oh yeah, well, no, we forgot about that 10% of the population. By which time it costs a fortune and it's really hard to do. So yeah, there is a shift in sort of, where we are being brought in at the early stages and advising and being trusted to give that impartial advice. Not always, but the majority of the time that is now happening. It's great to see.
Yeah. And I think that this is it. I mean, one of the challenges that I constantly have is, even with accessibility, is the sort of conversations, because we talk about inclusion a lot, and my job also has an element where we talk about digital inclusion, which is wider, right? And some of the built-in tools help inclusion, but there's also the connectivity, there's the social factors and all of this. But then when I talk to people that are specifically in the digital inclusion community, I frequently have conversations where I go, well, we're going to do the accessibility bit later, because that's really quite hard. Mm. And I think you've got it the wrong way around here. You do that bit first.
Yeah,
and then
there's
often becomes easier.
Yeah, it's cheaper and more effective to do it at the start. Yeah. Way more.
Yeah, but yeah, it's sometimes it's perceived as too hard. So you know what, we're just going to put that to one side, and it's like, yeah, but that's the bit that really needs you most. So if you really cared about inclusion, you'd be doing that first.
Completely agree.
Yes. So with this combination of bringing together of the assistive tech industry, what are the, and you talked about sort of finding those interesting niches that are not being served. So what are the things that you think are exciting, and what are the niches that you think are going to be productive for the AT industry, and also transformative for their customers?
I think that's a wide-ranging question, but a brilliant one. I think obviously artificial intelligence is making systems smarter, and that they're predicting the needs of the user. Examples escape me in the moment, but when you get home and everything has been sort of warmed up, got ready, your routine is known by your environment, and to be able to sort of anticipate your needs. The way that things are more interconnected makes your life much easier. I was working with products. It's a predictive texting solution. Does great stuff. But one of the things it does just simplifies keystroke input. So it's predicting multiple words in advance. It takes, if you're writing an email, it takes the name of the person from the email address and automatically says, when you write "dear," it sticks in the name of the individual. And it means that you're being effective, you're being consistent, you're being, you're minimizing your keystrokes and your effort, which is great for everybody. So I think, artificial intelligence and smarter systems are going to make a huge difference. I think mental health is a big one. I think that by giving experts availability and access to smarter systems that have a tiered approach to support and intervention is going to prove to be a huge benefit to many people. For the fact that, depending on what level of support you need at any one stage, you can sort of work with that system, who your trusted sort of people are you can reach out to. Or if it goes further than that, you reach, approach crisis moments, that there is a trusted network that you can reach at that moment of crisis. Not sort of, the next day, the next month, the next year, when you have a referral or whatever it is through your sort of systems. So I think, that sort of inclusivity and that sort of connectivity, the fact that, we can have these conversations across the world, I think it speaks volumes for what we can achieve. And I think, throughout the pandemic, people have looked a lot to assistive technologies and how they can help the individual. In their own environments is making a huge difference. I think obviously, everything we've got going on with home automation, the smarter homes is going to be fantastic moving forwards, and how we continue to work with our computers, how we interact with them, how we speak to them, or how they speak to us. And I mean that sort of universally is going to be a great journey, I think, and it's going to be fantastic.
So I'm having been shouting at computers for a very long time now, several decades, I'm still fascinated by speech technology, but I'm also very much aware of the limitations once you get out of the English language, or once you get non-native speakers trying to use speech tech. So my wife swears that Siri is both racist and sexist because she's from Southeast Asia, and it is, it just doesn't respond to her in the same way that it responds to me. Now, part of that will be my standard accent, because it's expecting, UK English. Part of it will be because I've been talking to computers for 20 plus years, so know how to trigger them. But it is definitely a challenge. So I think that, there are, and then when we think about, with disability, quite often there's additional challenges around the slurred speech or input, unusual accents. You've got the work starting right now on building voice models for deaf speech. So because if you were born deaf, you speak slightly differently because you can't hear, so you don't mimic in the same way. So and then again for speech impediments and so on. So there's areas there that I think are still require some significant work.
Yeah, there are, and I think sort of we're still sort of perfecting our interface, aren't we? I think we've we were just talking last week about the Amazon Echoes. And at the one time, that was proper science fiction. That was proper tomorrow's world. And now we're sort of getting used to that, but we're still not using natural language when we're sort of communicating. And if we don't remember all the right terms, the right commands, it still doesn't do quite what we want it to do, and does all manner of strange and wonderful things. And that's true across all the sort of the voice-activated systems. So they're kind of going in the right direction, but those smarter artificial intelligence systems will hopefully enable us to do an awful lot more. And yeah, non-English language stuff is sadly lacking on that.
Yeah, no. So I'm aware that we've already gabbed and eaten up our 30 minutes. I mean, one last point on the sort of smart home stuff before we go, and is again interoperability, because what we've got at the moment are these walled gardens. So your Siri won't talk to you, your Alexa won't talk to your Cortana, and actually we want people to be able to have consumer choice. We want people to be so for example, I really like iOS devices, but I don't like Apple Macs very much because the operating system's different, and I use Windows for my main PC. It would be nice to have one voice assistant that worked across both. So those kind of things are a barrier in themselves. But it's still better than it was. And we still need to celebrate, and we still need to thank the people that have invented the assistive tech and encourage the next generation. So thinking and thanking people, I need to thank Barclays Access for continuing to support us, MyClearText for continuing to keep us captioned, Microlink for also helping keep the lights on, and thank you, Antony, for the work that you're doing to support the assistive tech industry.
My pleasure, and I'm absolutely honoured to be here, sort of chatting with you guys today. It's a real pleasure. It's an illustrious company, so thank you very much.
Thank you.